Today we're having a retail therapy walk for research. It's a Myeloma UK fundraising event, and we've got approximately 100 people coming along, and they're all going to do either a 6-mile or 2-mile sponsored walk around the shops of Bristol, and they're going to browse, they're going to indulge in some retail therapy, and they're going to walk and be sponsored by their friends and family to raise money to support research into myeloma.
Well, we've come here today to do the myeloma walk to raise money and for they can do research on the myeloma cancer. We're here for a reason because Sal, her dad, died 4 years ago now. Was it 5 years, Sal?
4 years.
4 years ago from myeloma. So we thought we'd come on and do our bit.
Myeloma is a cancer of the bone marrow. It affects between 15 and 20,000 people in the UK, and it's a pretty complex and challenging cancer to live with.
We're doing the myeloma walk today around Bristol. We've come as a family. We're particularly involved, do you want to say?
Because our gran's got myeloma.
Yeah, my mum, their gran, has myeloma. She's had it for about 3 years. Well, she's in that hospital a lot of treatment. She's just had a stint in intensive care the last few weeks, but is up and about today, running around doing things. So, but yeah, it's been a hard 3 years for her.
My name's Jenny Bird and I'm a consultant haematologist working here in Bristol. So myeloma is a cancer of the bone marrow. It affects the plasma cells within the bone marrow, and these are the cells that normally produce antibodies. These plasma cells produce an abnormal protein in the blood. The effect of the abnormal cells within the bone marrow is to damage the bones. It can cause holes and weakness of the bones, and that can result in fractures and osteoporosis, thinning of the bones, which can cause pain and disability for patients. In addition, the cells within the bone marrow can affect the way that the bone marrow functions, and so many patients are anemic, and that can lead to fatigue as a significant symptom for patients with myeloma. The protein in the blood and urine can also cause damage to kidneys. The immune system does not function normally in patients with myeloma because levels of normal antibodies are reduced. And so infection can be a significant risk, particularly in the early stages of myeloma. There are significant side effects with the myeloma treatments that are available. And they include things such as peripheral neuropathy, which is damage to nerves, which can cause tingling and numbness in the fingers and toes, and low blood counts, things that we're quite used to dealing with, but that can involve regular visits to the hospital for patients.
I'm here because my sister died of myeloma in July, and 3 years before that my brother died of it.
Myeloma UK's role is to provide information and support to patients and their families who are living with myeloma. We also help to fund research and we raise awareness of the disease, and we also campaign to gain access to treatments for myeloma. We also have a network of support groups that are based around the country. One of our biggest is the Bristol support group. People get together and they share information, experience, and provide support to each other, and also have a range of people come along and give talks about living with and treating myeloma.
We're here to do the sponsored myeloma walk around Bristol. We're going to do the 6-mile route with a quiz, and we've raised about 1,500 between us.
And she is going to do shopping.
We're here to support Myeloma UK because my husband's been a patient for 10 years, and earlier this year he was no longer responding to the treatment he was on, and we were appealing for another drug, and we were having a bit of difficulty, and we appealed to Myeloma and they wrote a letter in support, and within a fortnight we actually got the okay for the drug. My husband's he's on his 4th cycle now, and he's making a response. So this is our way of coming out, a bit of publicity, and saying thank you. We're delighted to be here promoting myeloma and getting it in the public eye.